Good morning, everyone. I retired from my job December 31st after 50 years in public health. Needless to say, with the COVID virus pandemic, my plans for travel have gone astray. At the time I retired, I joined a group called the Medical Reserve Corps. And since the beginning of April, I've been making phone calls at the West Orange Health Department to people who were positive for the COVID virus. We asked them about their illness, symptoms, contacts, and we answered questions that they had about their illness. I don't have any direct patient contact, so I'm not in any immediate danger, such as our nurses and doctors. After making about 100 phone calls so far, some things have become clear, and they're very similar to what you've seen on the news. Firstly, nursing homes and rehab centers patients were the largest group of people who became infected. And also the people who worked at these businesses and who were often very low paid workers became infected. And I've interviewed many of them. The second largest group of people infected are the healthcare workers, and this could be in the hospitals or the nursing homes. And of course, it includes doctors, nurses, respiratory therapists, health aides, and everyone who does direct patient care. Many of the infected people that I've spoken to are low-wage paid people, and now they're unemployed, and many of them have no health insurance. They were not able to isolate or quarantine themselves in their smaller apartments, and many of their family members also became ill, and presumably with COVID virus, so that the number of cases that are officially reported is actually lower than the actual numbers of cases. Earlier this week, I drove by a local church that does a food bank, and normally I would see about 4 or 5 people in line, but this time I saw 50 people in line, and it shows how high the unemployment rate is. So, I have a few ways in which we can all help with this situation. One is continue to donate to food banks. Many people, as I said, many people are unemployed and they really can use help. Second is to donate blood. If you were infected and recovered, you can also donate antibody plasma, which is one of the hopeful cures for this illness. Stay strong and pray for an end to the pandemic. And while we hope that genius scientists are able to come up with cures and maybe even a vaccine, the person you really need to put your faith in is Jesus.
Thank you for watching. Please take a moment to like the video, subscribe to our channel, and donate by clicking on the link in the description. You can also follow us on Facebook.